Good morning or afternoon, depending on where you are. I first want to thank CurePSP for inviting us to be here to talk about the Speak Out Therapy program. It is designed specifically for people with Parkinson's and related neurological disorders. That's a pretty broad umbrella. And PSP is one of the things that the Speak Out Therapy program can help with speech and swallowing. I'm going to tell you a little bit about myself. My name is Gwen Nolan, and I am the Grant Development Officer at Parkinson Voice Project. So we have a number of missions here, but I'm also a practicing speech language pathologist with almost 20 years of experience working just with adults in medical settings. So hospitals, outpatient clinics, home health, all of that combines together. So I've seen quite a few people throughout my career with PSP. Prior to coming to Parkinson Voice Project, I was an assistant clinical professor at the University of Missouri, where through a Parkinson Voice Project grant, we developed a very robust program where we treated people with Parkinson's and PSP and MSA and so on and so forth at the university while training our students. So it was an amazing opportunity. My passion, the thing that makes my heart beat lighter and faster, is working with people who have neurologic disorders to help them regain and retain their speech and swallowing. It is possible. The vast majority of people who go through Speak Out therapy can maintain at least some of their speech. And we know how much more effective that is in PSP. So it's really important to be able to do what you can to help that. All right. A little bit about Parkinson Voice Project. We are a nonprofit organization. We're located in Richardson, Texas, a suburb of Dallas. We operate a speech therapy clinic and provide Speak Out therapy for individuals with Parkinson's, PSP, MSA, LBD, CBD, and essential tremor, because we know that Speak Out therapy will work for these populations. We can see anyone in the state of Texas, and some of us, like me, are licensed in multiple states. We do not bill insurance. We do not bill Medicaid. We don't bill Medicare for our services. We use a pay-it-forward model. So we ask our patients at the end of treatment if they want to pay it forward to the next person. And it's been very effective. We do 2 large fundraisers a year. And people, after completing Speak Out, will often pay it forward. Sometimes people don't have the funding to do that, and that's okay. They can help in other ways, take brochures to their doctor's offices or the pharmacy. Our donors provide a Speak Out workbook and access to our e-library, which has workbooks in many different languages and all different kinds of workbooks, at no cost to everyone who is treated by a Speak Out provider. People who are overseas, there's a $100 international shipping fee. But if you're in the US or even Puerto Rico, there's no cost, and we ship the Speak Out workbook to you to use and keep for practice. We have a number of things that we offer to help promote speech. And really, it's almost an extension of therapy. So there are daily online Speak Out home practice sessions that are also recorded and available on demand. We have an on-demand Learn About Parkinson's webinar that covers Parkinson's, but it also covers related neurological disorders, because there are some similarities there. We have a weekly sing-along. If you like to sing, that is every Thursday. And I think I have a slide at the end that I'll show you that has the days and times of that. but it's every Thursday right after the online session. It lasts about a half an hour, and it's getting huge. They sing all kinds of songs. So it's a fun way to get additional practice in. We also have a robust grant program, and our grant program trains clinicians and students around the world. So we have a wide presence in other countries: Australia, New Zealand, the UK, Ireland, India, Slovakia, Slovenia, Lebanon, the UAE, all over Africa. So it's been a really remarkable journey with the grant program. Our mission and vision, our mission first is to help people with Parkinson's and related neurological disorders regain and retain their speech and swallowing. It's why our organization exists. Everything we do goes back to that mission. Our vision is to collaborate with other compassionate speech language pathologists to make speak out therapy accessible to people with Parkinson's and related neurological disorders worldwide. So our grant program really helps to support that. About the Speak Out Therapy program. So it was developed to target the very specific speech issues associated with progressive neurological disorders. So things like Parkinson's and PSP and MSA. We know that it works for this population. We know it can help. We have research that shows that it can help. All right, hold on, I'm going to flip my notes over. It focuses on changing speech from an automatic function, what you've been doing your whole life, and converts it to an intentional act that is under your control. And that's a very life-changing concept, because we find that as your speech becomes more intentional and more deliberate, you're chewing your food more intentionally, more deliberately. You're drinking with greater intent. It just increases your level of awareness that spills over not just to speech and swallowing, but to other things that you're doing. It is very effective for PSP and other neurological disorders, despite the differences in speech and swallowing. And we know that the speech and swallowing differences with PSP can be more severe. So treatment early and often is really, really important. The 6 exercises are trained during Speak Out therapy with patients cued to lift their voice forward, lift their speech forward, speak out, say it with intent, use their intentional speech and voice. Everybody has a series of cues or things that they keep in the top of their minds that help them to remember that when they want to be heard and understood, they need to speak with intent. So we work with them and their families to find out what exactly that is, because then we can train it and we can help you. The keys to success are patient and family education first and foremost. Sometimes you just get a diagnosis and then you're left to Dr. Google to try to figure that out. That's what makes the CurePSP website so wonderful, because it's full of information that is really helpful for you. But we do a lot of education here at Parkinson Voice Project as a part of the Speak Out Therapy program, because it's absolutely critical. You need to know about the disease process, how you can regain and retain your speech and your swallowing. So patient and family education, daily practice. You brush your teeth every day, right? Daily practice must be a habit. Weekly speak out groups, and we put people in groups of their peers. So if someone has PSP, we try to put them in a group with other people who have PSP. And we provide family and care partner support so that they're there reminding you and keeping you honest to say it with intent. One of the things that we sometimes use, you can get this for about $10 on Amazon, but you can record anything you want, really. But what I do during therapy and my groups, more intent. I can push this button and it says more intent, and it's not like I'm interrupting. And sometimes for families, especially kids, absolutely love using something like a button just to kind of keep that intent top of mind. All right. So you've heard about Speak Out. One thing I want to add. So during the Speak Out treatment, it's generally 8 sessions. People with PSP may need more than that, and that is perfectly okay, right? Twice a week, you have therapy. Once you complete the Speak Out therapy program, we follow up in 2 to 4 weeks, see how you're doing, whether you're continuing with the daily practice, how you feel about your speech and voice. And then we make a decision. We may do some more therapy once or twice a week. We make sure that you're going to your group because that's really, really critical. And there are some people who I will see once a week forever because it's just helpful, right? PSP is a different animal from Parkinson's. And so the treatment is often more intensive. So we try to make it really fun, and it is. And I try not to use my button, but sometimes I do. All right, so let's give Speak Out a try, and we'll see how you all do. I wanted you to get a taste of what this therapy is like because it's really, really fun. The workbook has all 6 exercises. There are 24 lessons. And they start simpler and then they get more challenging. So we're going to start, the very first exercise is always the warm-ups. You want to produce those in a smooth and connected way, projecting your voice and your speech up and forward, every sound with intent. Watch me and listen, and then you try it. We'll do it together. You ready? May, me, my, mo, moo. So I'm really putting effort into it. I want you to try this and really put forth some effort. We'll do it together. You ready? Up over my head. May, me, my, mo, moo. On a scale of 1 to 10, how much effort were you using? Were you just kind of meh? Or were you like Scotty on Star Trek, giving it all you got? Let's try it again. Give it all you got. May, me, my, mo, moo. I'll let you in on a little secret. One of the reasons that these words and syllables are structured the way they all start with M. And M is a sound that you have to make here. So you can put your fingers here, may, and you should feel vibration. That helps to bring that sound forward because it wants to stay down here. PSP wants you to have a little tiny voice. I do not. All right. The next exercise is the ahs. It's usually everybody's favorite because they think it's the easiest. It's fairly simple to instruct. Mouth wide open, voice clear, volume consistent, lifting that voice forward with intent. To really do it well, you've got to throw that ah up and over my head. Or if you're near a window, throw it all the way across the street. Watch me and listen, and then you can try. You ready? Ah. We don't ever go longer than 10 seconds. You don't really need to. You have a drink of water and you need it, take a sip. And we'll try 2 of these. You ready? Lift your ah. I'm putting my ah up over your heads. You put your ahs up over mine. Ready? Ah. Good. Let's do it one more time. Lots of intent. Really speak out. Here we go. Ah. Good. You did it. All right, take a sip if you need it. And if you're talking a lot, you need to drink more. In general, all of you need to drink more. And water is good for you. It's good for your body. All right. The next exercise are the glides. And this really helps to stretch and strengthen those vocal folds. It brings the voice forward. And it adds that music that keeps your voice from being too monotone. So watch me and listen, because we're going to take that forward, and then we're going to glide it up, 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 and stop at the top. And then we're going to throw that forward and glide it back down to home. You ready? Watch me and listen. Don't worry about matching my pitch. You may have a different pitch that's comfortable for you, but let's try this. We'll do it 2 times. Again, mouth wide open, throw that ah out. We're going to glide it up nice and smooth, stop, and then bring it forward and back down to home with intent. Here we go. You got it. Let's head it back down to home. Were you intentional? Were you thinking about it? Remember, it's stretching all those little tiny muscles, and it's helping that air go from here out in front, up over my head. I want you pinning my ears back on this last one. Are you ready? Here we go. Good. Back down. You did it. Good job. Okay. Counting next. I'm going to do the first line so that you can hear how this should sound. But again, smooth and connected. Lift those voices up and forward. Every single number with intent. Watch me and listen, and then we're going to do all of them one time, stopping at the end of each line. It's going to sound like this. 1, 2, 3. Got it? All right, here we go. 1, 2, 3. Stretch those numbers out. 4, 5, 6. Good, keep going. 7, 8, 9. Finish strong with intent. 10, 11, 12. You've made it over halfway through. Your voices should be feeling a little bit stronger right now. All right, we're going to read a couple of sentences. So reading is a nice segue from counting because it's less of a burden than conversation, but it still challenges you because you're looking at words and you're saying them. So speak deliberately, lift those voices up and forward, every sound and every word with intent. Listen to me say this word and then you say it. Hello. Now you say it. Hello. One more time. Hello. Don't leave any sounds out. All right. Welcome home. Every sound and every word. Do it with me. Welcome home. One more time with intent. Welcome home. Good job. Take a sip if you need it. We're going to do a couple more. Here's something that's important to say with intent. You should always say this with intent. I do. You ready? I love you. Let's do it again with intent, up over my head. I love you. Lift those voices up and say it one more time. I love you. You say in every sound and every word like you mean it. All right. We're going to try one more. This one is a little bit longer, but you can do this. These words they're not too hard for you. I know you can. It's probably too easy for some of you, but that's okay. In therapy, we make it harder. All right. Can you help me? This is a question. So it rises at the end with intent, every sound and every word. Can you help me? One more time. Can you help me? All right. Guess what? You made it all the way to the conversation exercise. And this is my favorite part. In the workbook, this is amazing. And it starts relatively simply, but then you have the opportunity to really challenge yourself. Really let yourself practice speaking out. All right. I'm going to show you a picture and I want you to tell me what it is with intent. You ready? That looks good. It's going to be warm in Dallas this weekend. I might want this. All right. Say ice cream. All right. Where could you buy ice cream? Where could you get this? There's two places that I can think of off the top of my head. So you might get it at the store, or you could go to an ice cream shop. That's my favorite thing to do in the summer. All right. Let's try this one. What is that? Say every sound in the word with intent. Really speak out. Elephant. So where could you see an elephant? You might say, at the zoo. Say that with intent. Or you could say, in the jungle. All right. How'd you do? Did you have fun? I have one more for you. Are you ready? Okay. Now you have to guess what these are. You ready? I'm going to put them on, but I'm not going to be able to see anything. All right, here I go. All right, can you tell what those are? PSP often causes sensitivity to bright light. These are almost like blackout glasses because they're for the eclipse on Monday. So if you're going to watch the eclipse, you need to have these glasses. They'll protect your eyes from the sun. All right. We're very excited about the eclipse in Dallas. Okay, this is a list of resources for you. So you can learn more about Parkinson Voice Project and access all of the resources below by going to parkinsonvoiceproject.org. There are links to all of these things on our homepage. We encourage you to practice with our daily online Speak Out home practice sessions, Monday through Friday, 10 to 10:20. You can join the weekly sing-along from 10:30 to 11, U.S. Central Time. So depending on where you are, I'm not very good at figuring that out, but you can ask somebody who is good at figuring it out. You can view the Learn About Parkinson's webinar. Remember, I said it has more than just information about Parkinson's, so it's really worthwhile. You can view a presentation from our lecture series, learn more about the Speak Out therapy program, including the Circle of Intent. Because it's kind of like the Hotel California, but in the best possible way. Because the first thing we do is evaluate, and then, whoops, I went the wrong direction. I knew I was going to do that. Then the Speak Out workbook and e-library. You'll see this on the web if you look. The Learn About Parkinson's webinar, individual speech therapy, weekly speech and or singing groups, and a refresher. Sometimes we do them every month, sometimes 3 months, sometimes 6, sometimes a year. It just depends on the person. But guess what? This arrow goes all the way around because PSP is not going away, and we will not go away. We will always be here for you. Daily practice all around the outside, because that has to happen from start all the way around. That never ends either. Okay. A few more things that are on here. You can find a licensed Speak Out provider. So if you're interested in Speak Out, you'll see on the next slide, my email address is there. You can also find a licensed provider by clicking that link. All right. Thank you so much. I am so grateful for this opportunity to be here with you today.
Gwen, thank you so much. This was so lovely. And just a quick reminder, you can download Gwen's slides to keep those links and for reference, because I know we had to keep them up quickly. All right, Gwen, we have just a few questions for you.
Okay.
The first of the questions is, of the exercises you just walked us through, is there a specific one that is best for someone struggling with slurred speech?
All of them.
All of them. Great. That's
all
the
of
best
them.
answer.
Right. So it's called the Speak Out Therapy Program because they all combine together. And the trick is to get with a Speak Out provider. We have Speak Out providers in every state in the country. We will add additional therapy and research centers where if somebody can do online therapy, they'll be able to be seen in 25 states. Additionally, we'll have about 300 grant recipients at universities and clinics. Many of the universities do not charge for their services. So it can be a really worthwhile endeavor to look for those. And you have my email here, gnolan@parkinsonvoiceproject.org. Joanne and I would love to help you find a provider in your area who can help you online.
That's great. It's also so generous of you and your time. Great. So the next question is, and you provided this example with the button, but do you have any other tips when verbal communication is no longer a viable option?
That's a good question. So for me, using an augmentative system is a last resort, right? And it's because I can almost always at least get someone to be able to produce a couple of words. And when you think about it, that's really important because even though we don't quite see as many tremors with PSP, the motor issues and the cognitive issues associated with learning something, it can be very, very difficult. With that being said, there are some amazing programs out there. They're getting better, designed for adults who may want to use an augmentative device. Some of them are available on a smartphone. So there's a series of kind of free apps depending on how tech savvy you are, but that's something that you would need to find a speech therapist who really specializes in that, if that was the direction you'd want to go. And I would not abandon working on the speech, if for no other reason than speech and swallowing and breathing, they share the same muscle systems. They share the same space. So you really need that practice to keep those muscles moving, keep them from getting too stiff.
Great. That's super helpful context for kind of the big picture, especially thinking about how it connects to swallowing.
Right.
Okay, the last question I have for you is, I guess it actually kind of goes along with what we were just saying, but what techniques and strategies can care partners and family members use when supporting this type of, communication learning?
Yeah, and that's actually one of the hardest things. So I would say getting involved at the very beginning of therapy and learning as much as you can, because if you are just dropping someone off, you're not able to see what the speech therapist is doing. I know that some speech therapists don't necessarily love having family there. I would not be considered one of them. I love having family there, because they can actually see in real time and they can provide information. Everybody has bad days. So what I see, they can tell me in terms of a trend, what's helping. We can try different cues. And that's really helpful. They can be a practice partner, especially during the conversation activities. Partners can record a short conversation with their spouse or their family member and play it back so that they can kind of self-assess. And the last recommendation I have is, don't let crappy speech slide. I know how easy that is. And my father didn't have Parkinson's, but he did have a stroke. And there were strategies that he needed to use because of post-stroke speech issues. And you get to know somebody and you kind of know what they want without them even saying anything. But we don't want that. We really, really want for people to hold that person accountable. Ask them, can you repeat that with intent? Or lift that up over my head, and kind of watch that practice. If they're not practicing with intent, because a lot of people will watch Samantha and they'll be like, may, me, my, mo, moo. And no. That is not intentional practice. And so really watching for that. It's kind of like it takes a village.
Yeah, I like that perspective a lot.
Yeah, and even shortening, sometimes people will have a big, long sentence that they want to say, but breaking that into smaller bites can be a really helpful thing when you're trying to understand what someone wants.
Yeah. Great. That's super helpful. We so appreciate you joining us today, Gwen. This was really
Absolutely.
fabulous.
I am so happy to be here.
Great. All right, everyone, we're going to send it over to Joanna for some last remarks, and then we will go out into breakout rooms if you so choose. Thanks so much again, Gwen.
Thank you so much. Bye, everyone.